Welcome everyone to today's webinar, the 2020 Guide to Unleashing AI in Healthcare, 3 Expert Perspectives. I am Laura Dierda with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for questions and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We are looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it is now my pleasure to start today's webinar by introducing our presenters. Praveen Chaud is the Chief Operating Officer for the Adult Academic Medical Centers of Indiana University Health in Indianapolis, Indiana, the largest and most comprehensive health system in the state. Working alongside 6,000 colleagues and medical staff of over 3,000 providers, he is responsible for the oversight of daily operations as well as functional responsibility of key service lines, clinical non-nursing operations, and support functions across the 2 campus medical centers. In addition, he is at the forefront of bringing advanced analytics through AI and machine learning across the IU Health campuses to improve hospital operations and capacity planning. An experienced strategic planner and operator, he has deep industry experience in physician relations, service lines, mergers and acquisitions, benchmarking, long-term planning, large-scale construction and business projects, patient experience, and quality improvement initiatives. We also have Tom Morey, who serves as the National Director for Artificial Intelligence, Health, and Life Sciences for Microsoft. In this role, he serves as a strategic advisor to provide payer and life science organizations in the Americas. Prior to this role, he was the Director of Worldwide Health at Microsoft, where he worked with providers, payers, and life science organizations in planning and implementing innovative analytical solutions that improve the quality and efficiency of healthcare services delivered around the globe. He focuses on strategies for digital transformation applied to performance optimization, including artificial intelligence, machine learning, and natural language processing. He previously served as Director of Organizational Performance for Microsoft's Health Incubator Health Solutions Group. Prior to Microsoft, Tom served as Senior Director at GE Healthcare with global responsibilities for revenue cycle management, analytics, and operational performance solutions. Lowry was founder and CEO of Veris, a U.S.-based healthcare software company named as one of the top 100 fastest-growing Washington companies for 3 consecutive years and to the Deloitte Fast 500 Technologies list. We also have Professor Ankur Terdesai, who is a computer scientist and healthcare AI expert. He is the founder and chief technology officer of Kensai, a global leader in healthcare AI. Ankur holds a tenured full professorship at the School of Engineering and Technology, University of Washington at Tacoma, Washington. Professor Terdesai has published over 100 papers in machine learning and also successfully implemented numerous AI applications that are in use in various industries. Since 2009, his primary focus is to make AI assistive for healthcare. From advancing our understanding of population health and utilization for multi-morbid conditions to implementing responsible AI techniques for personalized precision health, Ankur Terdesai has been instrumental in helping healthcare organizations go through digital transformation using AI. In May 2015, after years of collaboration and applied research on large clinical and claims data sets, Professor Terdesai founded Kensai, a spin-out from the University of Washington. Ankur is an advocate for diversity and inclusion, women in computing, and enabling non-traditional students to consider computing careers. In 2019, he led as the general co-chair for the prestigious ACMKDD Knowledge Discovery and Data Mining Conference. Without further delay, we will jump into our panel discussion. Our first question is, what are best practices to keep in mind when commencing an AI implementation within a health system in 2020? Praveen, it would be fantastic if you could speak first, and then we would love to hear from Tom and Dr. Tara Desai as well.
Thank you, and good afternoon, everyone. In regards to best practices, I think through, and our health system thinks through the following in no certain order. But one is, alignment to goals. And if you can look at everything that you're doing and align to your goals, it'll become very clear in terms of where you spend your resources and energy. We look for areas in the organization that are ripe for disruption. So we all know within our organizations where we are ripe for disruption. And those departments or those leaders or those functions that are eager to take on risk and lead the way. So identifying those ripe areas for disruption is key. We've got to understand the potential impact that technologies can have on our work environments. We think through the applications and create and celebrate small wins. One of the other things that we look for here is also helping develop some level of expertise. So trying to identify those subject matter experts either through partnership or organic growth, but developing some level of expertise is something that we look towards. Also developing and doing your own due diligence in selecting a partner. And I think we can touch on that towards the end of the conversation, but also just doing your due diligence in selecting a partner. And then finally, one of the things that we try to advocate for here is to continue to look at your flanks and be an organization that can pivot, because flexibility and the ability to pivot is something that is going to be instrumental in future success.
Hey everyone, this is Tom Laurie. I'll jump in. Good morning, good day. When I think about all of the experiences that I see organizations like yours going through with AI, particularly AI at scale, everyone focuses on the technology, which is super important, but when it comes to doing things at scale that really matter, what I'd like people to think about is that there are actually two ways, and only two ways, that AI is going to add value to a health organization that's measurable. One is going to automate processes. Two is going to augment the wisdom and the work and the service of knowledge workers. So when you think about that, it's interesting to me how many times I get to work with organizations. They're pursuing AI, perhaps they're pursuing it beyond the proof of concepts at scale. How many are really not looking closely at having people like your HR experts on that team and looking at those processes? Again, anything that's going to drive measurable value is going to automate or augment. And what that really means is it's going to change operational and clinical workflow processes. And then finally in that, it's such a human process to consider. The second thing is to understand and get really good at knowing what AI is good at and frankly what it's not good at. I often hear people talk about automation in a way that they think we're going to put everyone out of work, and it's simply not true. And I'd end with just the posing the question of, everyone talks about artificial intelligence. Have you ever heard anyone talk about artificial wisdom, which are all those things that are unique to your humans, to your clinical workers, to any knowledge worker that is going to be super important going forward. And it's more about how we put AI behind their work.
Thanks, Tom. I'll address it. Good day, everyone. So there are many ways to establish best practices in an industry as diverse as healthcare. From my perspective, there are three important ways of establishing best practices. The first one really is about AI not being artificial intelligence, but rather being assistive intelligence. And both Tom and Praveen touched upon this earlier. But the idea is each organization needs to adopt a social engineering approach to an AI implementation by bringing in diverse stakeholders very early on and establishing baselines on performance and expectations regarding the endpoints of what an AI implementation is expected to achieve. If there is clarity in those endpoints, then any AI implementation can be marked as a success or failure very clearly, but knowing where that line or bar is extremely important. So that's the first idea of AI not as artificial, but rather assistive. The second best practice I feel many organizations need to start paying attention to very closely is the idea of responsible AI. Responsible AI is a shared responsibility. Today, across the globe, the biggest risk for AI implementations is an increasing amount of deployment of models that are black box, that are not open to inspection, and they can cause significant harm if we don't understand how and what the AI implementations are doing, especially if they are going to be in production for a very long time. So for healthcare in particular, we have to adopt better ethical, fair, and transparent AI implementations. So that's the second point. Responsible AI is a shared responsibility as a best practice. The third and the last point on best practices is operationalizing AI is not the same as building an AI model on a retrospective data set. Oftentimes I see organizations thinking that extracting a retrospective data set and then building a single model on top of that will ensure long-term success. That's just not true. One has to think about model applicability, accuracy, and performance over time. And as we all know, healthcare data is such a mess sometimes. It's quite heterogeneous. So pre-built models might not work well in many cases, but you have to have specific demographic solutions to which they may or may not apply, generating misleading results. Hence, I feel as a best practice, investing in a scalable, secure AI journey where solutions can be deployed rapidly as organization needs evolve, and they will evolve with early success and failures, is extremely important. So assistive intelligence, responsible AI, and operationalization of AI should be top of mind as best practices from my perspective. Back to you, Laura.
Thank you all so much for that informative response to my question. I really appreciate it. Now to dig a little bit deeper here, my second question is, what are some of the interesting use cases and applications you've seen where health systems are using AI to overcome a problem? Praveen, I'd love to hear from you first, and then Tom and Dr. Teradesai as well.
Super. Thank you. There's no shortage of use cases. The real challenge is going to be prioritization with those use cases. So I'll give you a number of examples of where our institution, as well as others, are looking at deploying and using augmented tools in partnership with our clinicians. So, for example, imagine the management or better management of disease progression. Take, for example, a 65 or a 70-year-old diabetic who we know historically may have a predisposition to retinopathy, a diabetic retinopathy. So imagine imagine that algorithm working with imaging, so where we are constantly looking at that patient's visual acuity and better managing whether or not that patient may actually develop diabetic retinopathy. That's one. In radiology, for example, we are already, and many institutions behind the scenes, are already using tools like artificial intelligence to leverage the thousands and tens and of hundreds of thousands of images, to where imagine a algorithm that now has all of this background information, to where we could potentially look for incidental findings. So it's not the thing that brought you into our healthcare system, whether it's a break or a potential image, an MRI or a PET scan. But ultimately, what if you ran that test through an algorithm and basically found an incidental finding that could be a potential identification for cancer, for example. We are also looking at tools that can help us. And the real key here is to think through, I think Tom said this earlier, it's augmented. And I think the other piece of this is we have to look at these as complementary, not supplementary tools. So, for example, when we're looking at and every healthcare system deals with this, length of stay. And this has been a pilot project of ours using tools to help us better predict what a potential patient's length of stay may be on the day of admission, so we can better prepare to discharge that patient in a timely manner. You know, I could go on and on. A couple of other examples are think through, again, radiology, but think through a risk fracture in an adult patient. Software searching for damage in the bones, specifically a common wrist fracture, for example, called a distal fracture. The software then utilizes machine learning and techniques to identify problems and marks the location of a potential fracture so we can better treat that patient, assisting our physicians with identification of a break. We're also looking at how do we use artificial intelligence to better manage supplies and supply chain management. One key that I think that we have yet to really explore, and I think this is a complement to another challenge that we have, is you look across the country and you look across the burden associated with the EMR, the electronic medical record. I have yet to meet a physician that doesn't feel the pain of that EMR to some extent. So what if we had a complementary tool like artificial intelligence and algorithms to better utilize the EMR and therefore reducing physician burnout? So those are just some examples, and the key really is going to be how do you prioritize and where do you put those resources so you can celebrate early wins and bring people along, because the technology's here, it's not going away. We have to understand how best to use it.
Well, just to pile on to that, and that was a great list. This is Tom Laurie from Microsoft again. So I'd riff on what just got said. So think about, I think every clinician understands the value and importance of an EMR, and yet when you look at the user experience, just sit with a group of physicians and get them talking about that, and it would be clear that it's not the best experience. But I want you to think about, like, every single experience you have when you're online, whether it's with Amazon or anyone else, or some of the smart apps on your phone, and how personalized those are to you. Now imagine the use of artificial intelligence to create that same thing with the experience clinicians have with the use of an EMR. And I think that makes the point that was just being made. Beyond what's already been said when it comes to care management, it really is a lot about risk stratification. There's a series of things that, particularly in America, we see everyone seeking out, such as readmissions management, predicting falls, predicting hospital-acquired infections, basically what I call the risk suite. On the high end of clinical, we're seeing people work with and experiment predicting end of life, which is a very interesting conversation, but it's really around end of life optimization of what you're doing to improve the quality for that patient, as well as look at resource management. It's already been mentioned about things like what we'd call patient flow. So length of stay predictions, very hot right now. Staffing optimization goes with that. Census forecasting, down to ED load predictions, wait times. And then beyond that, on basically revenue optimization, things like denials management. If I have the ability to put a sniffer on every single claim, if you're an acute care facility that's about to go out, and predict which ones are going to be denied and rework that, and if I can reduce denials by 20% with something as simple as that, it's a huge financial win when it comes to the cost of collections, what's happening to your days in outstanding receivables. If you're in a value-based care world, things as simple as prescription cost variance to look at all the variance in prescription patterns, that if you can reduce that variance, you not only improve quality, but you actually either reduce cost or improve your optimization in a value-based care world. I'll stop there. I'm afraid we haven't left anything for Encore. So Encore, what are your thoughts?
Thanks, Tom. There is actually a lot left to cover here. So let me walk through. As I was thinking about this question, I was reflecting on my own personal journey through the space of healthcare AI. And back in 2007, when I encountered my first healthcare AI use case, it was to try and predict patterns of dietary habits that help patients going through chemotherapy get better faster, or at least be able to take their chemo dose properly. So we were trying to predict the nutritional content that patients should have in order to go through the treatment. Now that led one thing led to the other, and I started working more on provider space with health systems across the United States, looking at optimizing a length of stay, bed management, patient and staffing management. And as the value-based care and reimbursement approaches started emerging from a policy perspective, several use cases started emerging in that space, from, as you mentioned already, readmissions reduction to predicting discharges and dispositions of where we are discharging patients, even trying to understand within the first 24 hours of an inpatient admission, whether the patient is going to be a short stay observation patient or an inpatient. We've done a lot of work on predicting census and load across the emergency departments as well as inpatient settings. Done some fascinating work on waste, cost, and fraud across the globe, trying to predict cost patterns and high-cost bloomers who might be medium cost today, but from a payer perspective will become high cost, and also from an ACO perspective become high cost in the future years. There is always a lot of opportunity for AI to make deep inroads in improving patient quality of life. Particularly, patient engagement and patient satisfaction is extremely important to quality measures and health systems, and that's always been a very interesting use case for AI. Primarily, if you think about a framework for AI use cases, in my mind, it breaks down into two major parts. There is AI predictions for healthcare that need to be done at the N is equal to big N level, which are at the population level, that help health systems at large operationalize the benefits of artificial intelligence in a meaningful manner across the organization on cohorts and phenotypes of patients and populations. These can be of the nature of analyzing variation between providers or analyzing variation between prescription behaviors, for example. And then the second part where AI is extremely useful and which comes more in the news often is at N is equal to 1 level, where AI is trying to create an impact on an individual patient by improving outcomes for that particular individual in a manner that is more meaningful to them. So thinking across the spectrum of continuum of care, a great framework to have for interesting use cases is to understand where we are trying to apply AI, whether at the population level or at the individual level, and then opening up that spectrum and trying to see so many use cases possible at each of these two levels.
Thank you very much for outlining that. This is interesting information. My next question here is, what does change management look like when driving an AI implementation? Tom, we'd love to hear from you first. Yeah.
Well, I guess I'd come back to my response to the first question. It's always interesting to me when I see organizations and organizational leaders getting really excited about AI, and let's be honest, AI right now as a technology trend is a shiny object. Any of you who may be going to HIMSS, when you walk into the exhibit hall, one only needs to look at what everyone's plastered on their booth to know what the shiny object of the year is. But in reality, it's a huge move forward. So you have leaders coming forward saying, we're all excited about AI, and I think this question is the most important. It's like, what do you do once you're excited and you're supposedly committed? And my quick thoughts are, the technology is important, but the value comes, as I said earlier, from driving process change. Process change is very tricky, and that involves looking at how to change the way everyone works. And when you look at intelligence now being built into the data sets, to the tools, that's dramatically different than the old world processes of having all these silos of data into which humans dip their data ladle into and make decisions. So I would strongly say it's about having a strong focus on workflow process. Any of you who have adopted a Lean or Six Sigma culture within your organization, bonus points to you. It's so much about looking at how to bring everyone along. I see many organizations moving ahead with AI, and they're not bringing their clinicians along. And so the last time I checked, if you're a healthcare organization that's driven by clinicians, it's not driven, as smart as your technical people may be, it really is about clinical engagement and really getting behind how those clinicians are going to be better in the future.
Thank you so much, Tom. And Praveen, now we'd love to hear from you as well. What does change management look like from your perspective when driving an AI implementation?
Yeah, just to build on what Tom was talking about, we take a look at, first and foremost, change is inevitable. How you bring your organization along and your people along through that change, and how do you manage expectations through that change is what's really needed. The first and foremost is organizations really need to have that kind of a function and really understand what change management can do for you as a strategic advantage. So having a very deliberate change management function and strategy, regardless of your initiative, is imperative. That's one. Two is, in particular to what we're talking about in our subject today in terms of artificial intelligence, I can't emphasize more the value proposition that this is a complementary technology, not as a supplement. Sure, we may displace some, and I want to reiterate, some functions, but all in all, this needs to be thought through as a complementary tool set. And then what really, in terms of from a change management standpoint, I think we just only need to turn to our physician colleagues and our clinicians to where we need to return them to what I would call top of license. So if you look at these types of tools, to really return them to top of license in terms of your change management strategy, getting back to a top of license. Finally, thinking through, think big and scale with intention. Be very deliberate in choosing the first 2 or 3 applications that can generate enough interest, that can generate enough of a learning to where you can actually build on success. So when we look at change management, whether it's a enterprise resource planning initiative, whether it is a new way to order supplies, whether it's a new HR policy, I think being very deliberate about what you want to achieve and communicating that in a very transparent and building trust manner is really what leads to success. So change management as a whole needs to be a function. It needs to be a function that is very deliberate, and it's a function that really needs to be resourced.
Thank you very much, Praveen. And Ankur, do you have anything to add here in terms of what change management can look like when driving AI implementation?
Absolutely. I think I agree with Tom and Praveen on the fundamental aspect of the organization taking ownership and driving the change management process, being very mindful about the social engineering approach that is needed to get all the staff engaged in implementing the changes. At the same time, I want to be a little controversial here and highlight the difference between general change management for ERP or EMR implementations versus an AI implementation and the role that change management plays in AI implementations. The reason for that is oftentimes AI is misunderstood or misconstrued to be a system that is going to learn from data one time and going to keep producing the insights again and again and again in a repeated fashion. Unfortunately, AI doesn't work that way. So the difference between regular system implementations and AI implementations that need to go through the change management process a little differently is something called the feedback loop, which is extremely important for successful AI implementations. So organizations have to embrace the idea that AI is going to require significant input coming from each of the pillars of that organization, feeding the feedback back into the AI algorithms and the systems in order for that AI implementation to be robust and accurate and successful over a period of time. That iterative nature of AI machine learning algorithm is something that can be better understood and operationalized if we can educate organizations on why AI needs these type of feedback loops to be put in place. And that's a very important component of change management that often gets missed when we treat it like other software implementations.
That's a great point. Thank you so much. The next question is for you, Encore, first, and then Tom and Praveen as well. What constitutes a truly tangible win when working with an AI partner who is helping health systems navigate through the AI clutter?
That's a great question. I don't think there's a single answer to a tangible win when working with an AI partner, but I've been an AI partner to many organizations across the world, and understanding that the process of an AI win goes from BI, AI to ROI is extremely important because we humans by nature, we are very used to insights and analytics, but not making actionable insights or not making those insights more actionable is something that often lies beyond us. So if we don't put the right set of baselines in place to understand what a tangible win looks like, and if we don't imagine that upfront, then navigating through the AI clutter becomes extremely messy, and we often don't succeed. ROI, for example, can be seen across different parameters and different use cases. One can use a disease management example for lowering risk of diabetes or lowering exacerbations due to COPD, let's say. And in that process, what does a tangible win look like? Oftentimes, it looks like something very simple as just reducing one presentation to the emergency department over a course of a year for a patient that is suffering from a chronic condition. While it may not sound like a big win, it's actually an extremely important aspect of value-based care in order to keep very sick patients out of the inpatient setting. So broadly speaking, a tangible win really comes together when there is a strong partnership and understanding between the health systems and the AI platform or the tool that's being implemented within that system in order to establish those baselines and then measure those baselines correctly and then celebrate those wins as they become more and more and more frequent in a very systematic manner, such that the whole organization starts sharing into the mission of saving lives through AI as an assistive partner that helps get closer to the best clinical outcome that we can get with supervised learning or the limitations that we have in AI technology today.
This is Tom again, just to add to what Ankur just said. So I'll bring it back to AI right now is the shiny object in the marketplace. And in saying that, what that really means is virtually every vendor trying to sell you something will likely be cloaking themselves in the aura of AI. And so the first question to ask is, are they really doing it? There are some studies out there that for every company who says they're doing AI, at least half, according to what study you look at, are really not doing AI. They're just doing something with data, and they're cloaking themselves in the shiny object syndrome. Two, everyone's early in their journey on true implementation of AI in healthcare. We are, you are, and so recognize that when markets are young, the use cases, the vendors out there, they will change, they will evolve. And so we see a lot of organizations out there truly doing things like machine learning, and they're good at machine learning, and they have an application. But if you look at the early evolution of other markets, including those of you who remember the dot-com days, there are a lot of one-hit wonders. And what you need to look at is 3 years from now, when everyone's evolving, who are the partners you pick now that have, one, the staying power, two, they know more than the technology. And this is where it's like, if you want me to predict something, tell me what you want me to predict, give me data, and I can correlate almost anything. What you really want is people who understand what you're trying to do in the clinical operational settings, who not only understand the role of AI and the role of the clinicians, but also are pushing on things as simple but important as, and Ankur mentioned, responsible AI earlier. Organizations that once they prove they know healthcare, they know machine learning, they actually are applying these other things that will come to the forefront around ethical AI. So that's things like, I can correlate things and actually predict things that you care about. And now the next question is, am I doing that in a way where I've stress tested my application for things like bias? Ankur already mentioned it, transparency. So I understand how it's making those predictions, and I can audit that as a continuous learning system moves forward. So those are just a few of the things that I would say you should look for.
And this is Praveen, just to build on some of those responses, what we look at, just some general thoughts. So it really may depend on what the need really is. And success may not be directly attributable to AI. It would, however, be attributable to how we use AI as one tool and many and across our tool chest. Several ways to measure success could be alignment with mission, alignment with our goals. Ankur said something to the effect of, making that difference for that one patient who avoided that readmission. That is success. Measuring hard ROI. It could be the profitability, or frankly, did the organization just get better and did we learn something? And how do we drive the change? For example, here at IU Health, we are almost fanatics about community health and population health, and making a broader impact to make sure that citizens in this state are healthier than before. And so just alignment with our goals, our mission, is one truly tangible way to look at wins. I would also posit that organizations like ours and other healthcare systems and hospitals, we have to recognize that we may need to fail fast, get up and try again, and in each turn, bring more people along. I think bringing along and fostering that culture of trust to alleviate fears in terms of what these tools may be able to do, that's another measure of a tangible win for our organization is, are we building that trust? Are we alleviating fears? fears, and are we getting people to work at their top of their license with tools like this?
Got it. Thank you all so much for speaking on this question today. I really appreciate it. Now we're ready to pivot to the part of our webinar where we'll be taking questions from our attendees. Thank you, Ankur, Praveen, and Tom, for this fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into the Q&A box you see on your dashboard. We will try to get through as many questions as we have time for today. Now, the first question we have here from an attendee is, how have you defined the business case or return on investment in defining and prioritizing the specific use case that you want to promote within your organization?
Do you have any order for how you want us to go? Or this is Tom. I'll jump in first. It's an awesome question. Many times what I see in working with organizations around the country is kind of the wrong way to start, which is you get some fast first clinician or someone who's so excited about AI, and they have their own particular use case because of their specialty, and that's great. But there should be a very informed process, informed being you start with what's your mission, what are your business goals? Against those things, what are all the things you could apply AI to do? Once you somehow have that universe of ideas, then there should be a set of criteria by which those are screened, where there are some things that would have huge impact, but take several years to implement, require massive cultural shifts versus, one of my favorites in the United States as a simple starting point with lower complexity are things like predicting denials and denials management as a way of having a use case that produces a measurable result over some time frame that makes sense.
Thanks.
Got it. Thank you so much.
I'll jump in.
Perfect. Thank you.
So, yeah, one of the things that we did early on at Kensai, when we struggled with this, helping many organizations going through their digital transformation journey through AI, we actually developed an internal tool called Project Florence. And the idea here was to use unsupervised machine learning techniques to study variation within the organization across its data sources. So the idea would be to see where an organization has the best impact that it can have on ROI through a data exploration mechanism by trying to see clusters and patterns of variation across behavior. Now, it could be variation in, say, lengths of stay between different facilities of a large organization. It could be provider variation. It could be pharmacy prescription behavior variation. So it could be hospital-acquired conditions, for example, or it could be patient flow to a certain extent. So just trying to understand where there is deviation from the benchmarks that are well established, and how much of that variation can you bend in order to generate an ROI itself is a very interesting and important AI exercise. And oftentimes I see our partners engaged in that exercise with us very early on in the journey in order to then make educated choices on which should be the first business case or the second business case that we tackle in our partnership. I'll pass on to Praveen.
Thank you. So for the ROI question is a very tough question to answer. There are applications, for example, Tom alluded to the denial management, for example, that has potentially a hard ROI. It is dollars that you can measure. Clinically, however, what we've seen is that over the course of the last year to a year and a half along the journey, using our lean methodologies and using the 3P format, for example, in terms of production, preparation, and process, what we've learned through the entire process of trying to implement some of these changes and tools is that our clinicians and our stakeholders have actually unearthed obstacles in their way to do their daily job today. And that in itself has been a win for us in terms of, I'll give you the example of case management. Case management and length of stay has been probably the most talked about AI project within our system. Across an entire year or so, we learned so much in terms of the actual day-to-day work that we actually looked at our processes, our production and preparation, the 3 Ps, to really look at those jobs and what we're asking our clinicians to really do. So what we took away from this was we would probably have not unearthed that level of deep knowledge and understanding to multiple jobs had we not gone through this process. In regards to a hard ROI, I think part of our challenge initially was looking at that pilot opportunity first and measuring a success in terms of, will this return dollars? And I think that we somewhat got hung up on that early on, where we had to shift our own thinking in terms of this may not end up being a $1-for-$1 investment. However, we can illustrate now that we've learned so much more as an organization and been able to apply what we've learned, that we are making some of our colleagues are actually doing their work at a faster rate, they're doing their work more accurately, and we are able to bring tools to their disposal to help manage things like length of stay.
That's a great point. Thank you so much for outlining that, all 3 of you. The next attendee question I have here is, the term AI is so misused. What is your definition of AI? And Ankur, could you begin, and then Praveen and Tom as well? We'd love to hear from you.
Sure. So, AI is defined as a set of algorithmic techniques that help solve a business problem by making use of predictions. That's a long-worded, intentful way of saying I actually don't like the word artificial intelligence. I've gone on record several times saying that if it was up to me, I would change the definition of AI to be assistive intelligence, where the idea that humans and pattern recognition algorithms are working in tandem in order to solve an important business use case. And the reason I keep stressing on that business use case is because without that context of the business in the middle, there is really no utility to designing AI algorithms. A great example of thinking about this, or rather the definition of AI, or thinking about the evolution of the definition of AI, is early GPS systems, such as mapping or navigating software. Several years ago, we used to buy paper maps and try to find our way through cities. Slowly came a GPS system that allowed us to enter the location of where we wanted to go, and we relied on that. Today, we not only enter the location, but very quickly get estimates on how much time it's going to take us and what routes we should take, and that system adapts to our preferences. So AI is not one single system or definition that can encompass all of it, but rather it's an agglomeration of many different things, including data science, pattern recognition, machine learning, etc. But it's an evolving definition at all times.
So to build on that in a non-technical definition, I'll just preface it by saying that I'll take any intelligence to help me solve for problems that happen every day in a healthcare system. And really what I'm looking for, what we look for, is those sets of tools, and what we're really talking about here is machine learning. And we're talking about computer science in terms of supporting the work of our clinicians. And I want to emphasize that aspect is and I agree with Ankur's terminology. Looking at artificial intelligence may not best describe what we're really going through. What we look for, what I look for, is anything that helps our clinicians do their jobs better and is not going to be an added burden, and instead returns them to be really, truly clinicians. So if we can develop tools and applications that really returns them back to what I would call top of license, that is what I would consider as an application of artificial intelligence. You know, we can get into the technical definition, we can get into the history of artificial intelligence, but for those of you who've been in healthcare for a while, may recall back in the 1980s and 1990s, we had what was called the DRG grouper. And the DRG grouper was one of the first applications of applications that we saw in academic medical centers, best practices on how to treat certain diseases. And that was algorithmically driven. It was driven with hard science, but it necessarily didn't take hold. And I think if you just go back to the history of what we're trying to do in medicine, we always, in some form or fashion, always use resources that help complement what our clinicians are doing.
Well, just to round that out, first I'm going to be a shameless self-promoter. So I have a new book from HIMSS Publishing coming out in 2 weeks. I've got a whole chapter on what is AI in non-technical terms specific to healthcare. But what I would say simply is, to me, AI is intelligence demonstrated by software with the ability to depict or mimic human brain functions, and really operative on depict or mimic, not replicate. In America today, if someone in healthcare tells me they're interested or working on artificial intelligence and its application, 9 times out of 10, what they're really talking about is wanting to predict something, which is machine learning. Beyond that, though, we're seeing the great and fast emergence of other components of AI, such as vision, language, search, knowledge, speech. And what I would say is, any of you who are AI experts or programmers, boy, good to you. You've got lifelong career opportunities. But if, like most, you're not a technical person and you really don't understand how an algorithm works, that's okay. What you need to understand is, what are the building blocks of AI that are commercially available today? Because if you understand just what's available, and you are the process expert at RevCycle or something clinical, that is the most important combination of how to drive change. But it's understanding the building blocks, but it's all about these systems that mimic or depict human brain functions that heretofore has never been built into data systems.
Great. That was really helpful to understand. Thank you so much. The next question we have is, you all mentioned examples around denials management. How would you go about defining what data points to concentrate on to be considered relevant in predicting denials? And there are many factors to consider, this attendee points out, that make up the front design overwhelming, including the payer, procedure, and DRG. So the question here is really, what data points should they be concentrating on to make sure they're predicting denials appropriately?
I'm waiting for Ankur to kick in as our resident expert.
Yeah, great question. Denials management is one of the most complex use cases for machine learning to handle, simply because the number of codes and the denial codebook keeps changing so rapidly. So one of the biggest challenges in denials management is trying to estimate the likelihood of a particular code being generated when that particular claim gets denied. And there are, some good technologies and solutions out there that are working quite well, but the data points that one has to consider as relevant when predicting these denials is really the quality of the, of course, coding comes into play. Moreover, the comorbidities and other factors like medications that the patient might be on, any sort of an evidence that can be included in order to reduce denials is very helpful from the provider perspective. And we are seeing increasing amount of intelligence coming into the gateways of trying to understand which claims are incomplete or can be likely candidates for denial. So it's a whole workflow that is going through an AI augmentation, and it's a fascinating space to be in if you are a geek like me who's interested in trying to detect these patterns using machine learning.
Yeah, Ankur, just to pile on quickly, it's a great question. I'm going to take it one step farther. So what's interesting is, what's the complexity of data? And to your point, there's complexity in coding data, but then even beyond that, going to that next level, one of the things that we're seeing that has even more complexity and yet is so powerful is the addition of what is popularized now as social determinants of health. So whether it's denials or whether it's some of the early work that I was part of years ago on predicting readmissions, many times we think about data as being our own, what we're holding. But things like readmissions, many times the variables have little to do with clinical and more to do with, are you discharging a senior citizen to a home where they live alone or they have a flight of stairs? And so when we think about data and predictive capabilities, I always encourage people, because many times we're always thinking inside the garden walls of our data, and yet when you start adding other data, which increases complexity, it greatly increases the ability to get very precise in making predictions around things you care about.
Just to build on both of those answers, think about other technologies like, and we can do an entire seminar or a workshop on robotic process automation. Now, just to build on Ankur's example, what if you actually had the language of your current contract with that payer, and we were always running that contract to that particular case that's being adjudicated, and now you actually have processes behind the scenes. This is not fiction. This is something that is applicable today, to where you take things like robotic process automation, like the artificial intelligence algorithms to better manage compliance to a contract, which then gets to better denial management.
Thank you so much for explaining that. That's really helpful. We have time for one more question here, and the last question is, do you see significant use cases for AI in the revenue cycle? And, feel free, any of you to...
In our system, we haven't deployed or looked at artificial intelligence in depth in terms of the revenue cycle, but there are case studies that we are now reviewing to see if they're applicable to our system. Not a large scale priority, but it is something that we think as the technology matures and we look at our partners across the ecosystem exploring.
I'm seeing that, particularly in the United States, as an area that a lot of people are focusing on. Some of it depends on how you define rev cycle, but it is everything from denials, as we've touched on, to other things such as predicting no-shows. If you look at the average cost of a no-show to a clinic or hospital today in America is about $200. So the ability to improve revenue, the ability to improve things like reducing errors and denials, we're seeing a lot of uptake and interest in that right now.
Yeah, agreed. It's a very complex and big space. There are many low-hanging fruits within the rev cycle framework. We've been focusing more on the variation analysis of claims, trying to understand the differences and the nuances between the various claims that are generated by the system in order to then understand how we can improve the return on investment of the entire claims management process.
That's fantastic. Well, that is all the time we have for today. I want to thank Professor Ankur Teradesai, Praveen Chaud, and Tom Lowry for their excellent presentation, and Ken Sai for sponsoring today's webinar. Enjoy the rest of your day, and we look forward to having you join us for future webinars.
Thank you.